We are very active participants in research in primary progressive MS. The National Multiple Sclerosis Society has an association of researchers, both academic and industry, that are dedicated to addressing the progressive forms of MS. And as yet, there are no approved therapies for the progressive forms of MS, and in particular, primary progressive MS. There's hope with ocrelizumab that completed a trial in primary progressive MS that drug may be approved in the future. But right now, the holy grail would be to find a drug that protected or allowed regeneration of the nervous system after injury, and there just aren't any ones that are approved yet. Our most effective treatments for the relapsing forms of MS have been treatments that have decreased inflammation. As MS progresses and the most relapsing patients convert to what we call secondarily progressive MS, where relapses essentially go away, but physical disability progresses. That is not characterized by excessive inflammation. It seems to be a more primary neurodegenerative process, and frankly, we don't understand the biology of that degeneration well enough now to have focused therapeutic approaches to preventing it. The future is quite bright. We are getting much better at having imaging be a prognostic factor in allowing us to perhaps select the right drug for the right patient at the right time. Are we willing to take a drug of high efficacy but high risk and start it initially in a patient? Well, if we can develop the kinds of prognostic tools, whether they're imaging or some biologic specimen, we may be able to do that in the future. I will say that in medications that prevent neurodegeneration or promote neurorepair, it's much farther off. We're looking probably not in this decade, but the next to establish that. Right now, the MS patient has so many more choices. If one drug isn't right for them, there are others, and that just didn't exist. When I started practice, MS was a devastating disease, and that, of course, was, some 30 years ago. Now, the very nature of MS has changed. It is a more mild disease. We don't see the malignant progressions nearly as often as we did before. More people with MS now are working for their whole careers. They're engaged in all kinds of social activities to promote a happy, meaningful, and productive life. EMD Serono is actively involved in research on new treatments for multiple sclerosis. We have a robust pipeline for drugs for the future. We have a great hope that we'll be able to indeed augment the therapies of MS in a very meaningful way. So it's nice to see such a concerted effort working on this miserable disease.